listening to the Pharmacy Podcast Network.
Digital therapeutics, known as DTX, are evidence-based therapeutic interventions driven by software to prevent, manage, or treat a medication disorder or disease. Pharmacists play a critical role in the adoption of digital therapeutics, and this series will provide the latest on the innovations in pharmacy care.
Hi, I'm Simi Byrne. I'm the host of Digital Therapeutalks, and here today is a very special guest with us. It's Melanie Doss, PhD. She is a San Francisco-based freelance science and medical writer specializing in fundraising for early-stage biotech startups. Welcome, Melanie.
Thank you, Simi. Thank you for having me on your podcast. I could talk a little bit about myself. As you mentioned, I am a freelance science and medical writer. I previously was a bench scientist for 14 years, working on all types of science, from neuroscience to virology to stem cells. And I think you and I bonded on that in the past few months. Like, we just both really love cool science. And, at some point I realized that becoming a professor, I'd have to fall in love with one signaling pathway or one cell type. And I just couldn't do that. I love all science. And so that became my new journey of finding out where I can make an impact about, helping people develop their science. And I found writing as a way to do that. I had a lot of experience grant writing as a scientist. I helped write several $1 million NIH awards. And then I also helped develop some fundraising materials for philanthropists interested in our research. And so I kind of transferred those skills into becoming a freelance writer. And so now I've been helping early stage startups with really cool science, really impactful science, to kind of develop their work by creating investor materials, so pitch decks or FAQ pages, or grants, writing grants, small business or government grants to help startups launch. And, the more I worked with these clients, I, came to know their product. And so that sort of expanded to doing other work, including, increasing marketing and sales of their product or their science. So that's kind of how my journey began, and where we connect, because we both love digital health and really cool technologies that are changing the world.
Absolutely. Thank you so much, Melanie. I mean, Melanie and I have had several conversations recently, and I want to share one study that we've talked about, which is digital health funding and equity problems. So here are some statistics about digital health funding. This is from the Rock Health Diversity in Digital Health 2020 annual report. So here's a couple insights. Investors are more likely to ask women leaders about the potential for losses, and men are more likely to be asked about the potential for gains. So, Melanie, I'm curious what your thoughts are on that as somebody who writes for the specific purpose of fundraising. Does that surprise you that women founders, when they're fundraising in digital health, are more likely to be asked about the potential for losses, men asked about the potential for gains? What are your insights on that? Does that surprise you, terrify you? What do you think?
Right. I mean, I could have said that's very obvious to you. I'm sure you feel the same way. Even if I wasn't involved in fundraising, in the past few years, I've had numerous interactions with people when we were hiring researchers or scientists, and we would have male scientists and female scientists. And there was this pattern that I noticed, and I talked to one of my female mentors, which was, when we were talking about, should we hire this male scientist or should we hire this female scientist? The pattern was, I see this guy doing wonderful things in the future, and then has this woman really proven herself? It was just the same thing. And it was such an unconscious bias to, it could have been men or women interviewing, but it's just the way we're like, we're kind of having to do everything twice, prove ourselves 3 times more than any male competitor. And I think the same logic applies when we're looking at funding and the venture capital world, which is something I'm pretty new to myself, but I go pretty much every week to watch pitches in front of venture capitalists from some of the startups I'm working with. And, one of the first things they tell you is you need to have a warm pitch. You need to network with people. But I go into these rooms and then there's these 6 foot tall, straight white men in these like tight little circles talking to each other. I'm 5 foot tall. You can't see that, but very small. And, like, how am I going to go in there and be like, hey, I'm Melanie, I'm this and this. And, it's so hard to just network even and get your foot, like literally your elbow in the door sometimes. And the fact that networking is one of the ways to really get your foot in the door for venture capitalist funding is difficult because, and I think we've talked about this too, just the way that a lot of venture capitalists are saying, I'm not going to put my email out there. You're going to have to come find me. That already introduces some bias. Like, the people that are introducing themselves, it's like, oh, my father went to Harvard at the same class as you, who are the people that can do that and who are the ones that are excluded? So to answer your question, no, not surprising.
Oh my goodness. Absolutely. I recall when I worked in my days in the pharmacy that I managed a whole startup pharmacy, teams of pharmacists, technicians, billing departments, like even delivery and courier. There's very complex 24/7 statewide operation. And all the time, people would come into the pharmacy, like vendors or regulators or different people, and walk straight to one of my staff pharmacists because he was the only, older, gray-haired white gentleman in the place, and ask him questions, assume he was in charge. And he handled it beautifully. And he would say, I don't know, you need to ask my boss. She's right over there. And yeah, there I am, a youngish looking brown woman with a nose ring at the time and a mohawk. Didn't look like I fit the profile, but this is what healthcare professionals look like. This is what PhD scientists look like. And we are making those changes. I mean, so important. So a few more stats from this report. 40% of women digital health founders are venture backed versus 62% of men founders. Black leaders report access to capital and ability to connect with investors as barriers more than white and Asian leaders. Asian men are most likely to be venture-backed at 72% and least likely to bootstrap at 11%. And Black women were least likely to be venture-backed at 14% and most likely to bootstrap at 57%. No woman of color I know is surprised by these statistics. And so clearly, digital health has a huge equity problem, just like healthcare has a huge equity problem. So I wanted to use that to segue into my next question for you. Melanie and I have been talking about protest and a nurse protest about AI in particular, close to her home in California. I would love to hear what your thoughts are on that protest, Melanie. What are you seeing in that trend where nurses are protesting AI and protesting the use of artificial intelligence in healthcare? Trust nurses, not AI is one of the slogans. Really interesting. Right. What are your thoughts?
Yeah, so I think the incident or the event that you were mentioning happened just a few weeks ago in Oakland in the Bay Area. And it was a protest by the California Nurses Association. And when I first saw the news, I heard them chanting what you just said, but they also said, AI has got to go, AI has got to go. And so, it's catchy, but I don't think that was the actual rationale behind their protests. Really, what they wanted was to be more involved. So Kaiser Permanente has tried to, they've tried to update and really be the leaders of AI technology and incorporate that into their system. But it seems like there is a lack of communication between their first customers, which are the healthcare workers. They're trying to increase revenue, but one of the biggest mistakes that I even see with startups is that you really need to know who is not only buying your product, but using your product. So perhaps the hospital is buying your product, but you need to involve the healthcare workers and the patients to actually make sure that your product's being used. And here's an example of what happens. The nurses weren't really being informed of the type of AI that's being used and whether it's even useful. Like they should be on focus groups and they should be asked about using this technology. They're the ones that'll be using this. And instead, it's a lot of fear mongering because it's, they'll get taken advantage of. Historically, they've been taken advantage of. And who makes up the huge population of nurses? It's women and primarily women of color. And, I don't blame them for being afraid of something that is not clearly explained and they're not included. And so really what they're asking for is to be included at every level of this new technology. And you and I know that AI can really change the world and it can help the healthcare system and it can help overburdened healthcare workers, but it's not going to do anything and perhaps bring in like more hatred against new technologies if they're not included in the conversation. So I thought that was a really relevant to what we've been talking about lately about, really understanding who your customers are when you're developing new technologies and including all of them in your conversation because you want them to be your allies if you really want them to be using your technology.
Absolutely. So, the concept of representation is so tricky. It shouldn't be because it's quite obvious that this representation and diversity shouldn't be just about getting a woman of color's face on your about page while you continue to do exactly what you were going to do anyway. It's about who's leading the conversation. It's about who's identifying what problems need to be solved and which don't and how to do it. And that is why I think both of us are so passionate about uplifting underestimated people, women of color and others in digital health, because clearly we have a lot of problems in healthcare, in biomedicine. There's a ton of interventions, a ton of super expensive medications, but then not enough focus on prevention and not enough focus on using technology. Like this is what I would love to see, using technology to remove the barriers that prevent people from being human in healthcare, whether that's face-to-face connection with that frontline care worker that you mentioned, who is more likely to be a woman of color, who's doing that direct patient care. How about we help reduce the administrative burden that's making it difficult for her to do her job in a way that cannot and should not be replaced with a robot? I could go on and on about this. Like my world in pharmacy in the traditional setting was in geriatrics. And so I've seen many examples of innovation, for example, like robots designed to provide compassionate, like stand-in care for people. Who might have dementia, may not even realize that this is a robot. Can they even consent to that? And where people are almost encouraged to connect on a deep level with a piece of technology. Well, why don't we just like use the robots to do all the other crap that's keeping people from actually interacting with people? To me, that doesn't sound like progress. That sounds like moving backwards. So I would love to see more ideas for technology in healthcare that are designed at actually reducing how much technology that we use. Like, where's the AI that does all the boring stuff? It should be humans doing the compassion and the connection and robots doing the busy work, not the other way around. And so I think that that's the message I hear when those nurses are protesting, and I absolutely agree with them. And I would love to see more of those nurses and those folks, those voices involved in digital health startups and involved in digital health solutions. And, people should be asking them. I mean, this is huge. So we already know. So on that point, we already know, right, that racial bias infects the US healthcare system. We already know that. But when those algorithms are already based on inequality, and then we use those algorithms to do more work, guess what? We're baking in more inequality into the system. So it's not just about the AI, it's about how it's being used to further inequality. And there's an example of a study about that with a healthcare risk prediction tool designed to flag sick patients who need more intensive care. So this is a commercial tool already used on 200 million people per year nationwide. And it's, sounds good, helping people stop people from falling through the cracks. But what ended up happening is the model assigned less care to the sickest Black patients compared to white patients. In other words, Black patients had to be sicker in order to deserve more care than white patients, according to the algorithm, because the model predicted healthcare costs it used healthcare costs as a proxy indicator for severity of illness. Like, that's not a glitch. We already know that Black patients receive less care because of systemic inequality. So the algorithm is going to perpetuate the same bias. In this case, Melanie, would you say that, like, how would you explain that to somebody? Is AI the problem, or is inequality the problem? How do we move past that?
It's obviously inequality, and it's inequality at different levels, right? We talked about fundraising. We talked about the customers, the users of the apps or technology, but it's also embedded in the apps, like you said, like something as simple as we're going to track your steps by putting the step counter on your phone, and you put your phone in your pocket. Well, men usually put phones in their pockets. Women, you don't usually have pockets in their clothes, unfortunately. And so, it's not as accurate. There's little things that are just so obvious to someone that is living that experience that is not obvious to someone outside of that experience. And really, it's like a business strategy. If you want this technology applicable to a wide population, then you need to be incorporate and acknowledge your biases and acknowledge your blind spots and hear from other voices. And things like protests, it's like no one's asking us, so we're going to tell you. And we do need more of that, because if no one's going to ask nurses or healthcare workers or women of color how this new technology is going to be built, we're just going to rebuild another new system of inequality.
Oh my goodness, absolutely. And I think that this is true in biotech, in healthcare and medicine, but in every field of society, whether it's like education, economics, anything we're doing. If this is our opportunity to do something different or to perpetuate and amplify more of the same problems that are root causes of the inequality that we already see. What are your thoughts on the drive to innovate in such a way that is sexy and cool? Like, for example, AI powered drug design to make a new molecule to treat something versus doing something mundane and boring that may not be something you would watch on Grey's Anatomy, but might actually be what people need. How do you work with clients to help them determine how to target that messaging and make sure that they get funded, that they're solving, like, as you mentioned, that actual problem for an actual person? Are they talking to that actual person? Do they understand that problem? Do they have on the team the expertise needed to work with the actual users of the technology and the people it's going to impact? What would be your recommendations for early stage startups who are wanting to make sure that their strategy is actually going to solve a problem that people need solved?
Right. So I think the number one strategy is to be open and flexible, and it's rare that a company starts and finishes with the same idea they started out with. And the reason is, you constantly have to pivot. You pivot because of what your venture capitalists or your mentors are telling you, but you also need to pivot because of what your audience is, your customer base is telling you. And so I would recommend startups to continue to improve on their product by doing focus groups, asking a diverse set of clients or customers or potential customers, incorporating that feedback and continue to change your product until it's perfect. I mean, you do that anyways as a new startup, but that's where the building phase is, and you want to start out on the right foot. So be open to feedback and continue to change and change and change until you've perfected your product.
Amazing. I'm looking at venture capital stats from about women of color, and this is, an issue in venture capital for, I would say, imagine all industries, but particularly in in digital health. So women get less than 2.5% of venture capital goes to women-founded startups, which means the other 97.5% does not. I mean, unsurprisingly, situation is even worse for women of color. Over the last decade, Latinx women-led startups won only 0.32% of venture capital funding, and Black women only 0.0006% of venture capital funding. Now, I know that your mission as a fundraising expert, as a medical and science writer, is to turn this around. Do you think that there are challenges and barriers that women of color face when thinking about something like venture capital funding, how to get access to this funding? How does that world even work? As you mentioned, I really, felt that what you were saying about like groups of 6-foot tall white men in groups and networking events, and then being like, how do I even break into that space? And what are we going to even talk about? And like, what would you recommend, or what do you recommend to your clients, to your network, specifically women of color, or other underestimated people who are founders in digital health, to not be afraid of talking about money and talking about fundraising and seeking support? What are your thoughts there?
Yeah, I mean, to directly answer, absolutely. I think what you and I have talked about a lot is becoming thought leaders in your space. And for both of us, I think LinkedIn or just writing in general has given us that power in our hands where we're talking about what we care about and what we want to change. And you don't have to be in a room trying to network, because you have this digital platform. And again, digital technology can really change the way that people can network. And no one has to see that I'm 5 foot tall and that I'm, very young looking, even though I'm not actually that young and I'm pretty experienced. And, they're actually just reading my words. And for me, that's really powerful. And I definitely encourage other people trying to get funding to put themselves out there in a space where, it's probably scary, but you have good ideas. You need to speak them out. And the second, which is not exactly what you asked, but I would love to see just more education on the venture capitalist side. I went to an event like just a couple weeks ago, and there was a female venture capitalist, which you rarely see, of course. And someone asked her, how there's only 2% of women getting funded. How do you help with that? And she was like, well, we really just look at how good the company is doing. It doesn't really matter if it's a male or female. And I'm like, she kind of just missed the main point here. It's not that you're looking at all the companies equally. There's just inequity in how you're viewing them. There's this unconscious bias, whether or not you're a male or female investor, and just becoming more educated on, some of the stats that you read out today. Are you asking women about their potential? Or are you just looking at, whether they can do what they say they can do? So I think more education, and there's obviously many people trying to start their own venture capital firms that are specifically focused on women or women of color or minorities. So that's obviously going to change the face of venture capital investment. And people are starting to become more aware that there is a huge inequity. I mean, 2% versus 98% is huge. And I hope that, education on one side and a lot more thought leadership and, speaking out in digital spaces can be a really handy tool in getting your mission and your product out there.
Absolutely. I mean, there's so many ways that people can look at that statistic and think, oh, because women of color don't have as good of ideas or don't have as much,
Right.
to
Yeah.
do, which is so far from the opposite. And I think that you're exactly right, that it really revolves around educating everybody in this space, because women are more likely to have to be caregivers for children and elders at the critical point of their career, where they're getting that momentum, all of those things tending to coincide, more likely to be immigrants, more likely to have the burden of generational trauma, more likely to experience illness. Like more and more younger women of color are getting autoimmune diseases. There's a spike in young women getting cancer. Like, why are these things happening? There's more likely to be surviving systemic trauma, individual trauma. I mean, there's all kinds of factors that are interlocking, less likely to have a network of support, and more likely to be supporting other people. So if all you have to do is focus on your goals and your whole family is super well connected, and you've got a wealthy uncle, and you've got connections from, your dad's alma mater, and like all these different things, then it's a very different picture than if you're somebody that doesn't have all of those privileges. And I think that it's, astounding to me that we're still hearing kind of a we don't see color, we don't see gender.
Exactly.
Like, it's time to catch up to 2024. It's time to start seeing it, and it's time to start addressing it. And I think our patients are depending on it. Our public is depending on it, because these are our communities. These are our families.
Right. Yeah.
So, so on the point of connecting, on supporting one another on LinkedIn and building community, Melanie and I have been talking about the need to invite more women of color and other underestimated people into the conversation in digital health. Tell us a little bit about that, Melanie, what we have planned.
Yeah. I mean, I think you and I have been yearning for kind of a space, like a safe space for us to meet other women of color, other people of color that are in our industry, and just talk about, our experiences, our backgrounds, maybe even strategize, mentor one another to kind of help each other become thought leaders, foster our ability to become thought leaders, or to, live in this space and grow in this space. And how do we become the future? How do we course correct this new technology? It's both a place where we can talk about careers, but also, design the world we want to live in. And I think just having a space for us to connect and meet each other, again, a great way for digital technology to bring us together. I think you and I have been thinking about putting together just a room for us to talk informally a little, and just talk about, our experiences.
Yes, absolutely. I mean, we can support each other. We can uplift each other. I always say we don't really need to go to a boys club when we have each other. We can uplift each other. We can support each other. We can fund each other. We can hire each other. We can work with each other. And at the very least, we can support each other. And I think that that's what it's all about. So I would love to see more women of color and other underestimated people connecting about digital health, about health tech. It doesn't have to be, you don't have to have technology training. You don't have to have, that's a lot of these gatekeeping and barriers are being reduced with advances in technology. And it's really about a passion, about an idea, and exactly what you said, Melanie, being able to imagine, what do we want the world to be like? That's the imagination that I want to hear from, is people who typically don't have those platforms or don't have access to that funding. And I know that that's super important to you as well. So we are going to be continuing this conversation on LinkedIn, and hopefully by the time you listen to this podcast, or it might even be way later, you'll be able to find out how to get involved in that conversation by following Melanie on LinkedIn, following me, Simi Byrne, on LinkedIn. So it's Melanie Doss. And let us know, Melanie, how do people get in touch with you if they have questions about fundraising, if they need a writer to help them write a pitch deck or a grant application, or to work on that messaging? If it's an early stage startup, or maybe it's somebody who has an idea, how can they find out more?
Yeah, I mean, I love to talk to people, even if their idea hasn't totally crystallized yet. You can easily find me on LinkedIn, Melanie Doss, and I also have a website, consult-brainwaves.com, but that's also linked on my LinkedIn. So again, probably find me on LinkedIn.
Amazing. Looking forward to continuing this conversation with you, Melanie, and with many more women of color in digital health. And I would love to see more thought leaders that are coming out of secret hiding. I think that we already have these thought leaders, these secret subject matter experts, but you never hear from them if they don't raise their hand, if they don't speak up, and it doesn't have to be perfect. And I think that we can really support each other in that way of supporting what we're talking about, the ideas we have, and building those conversations so together we can imagine a new way of healing and health in the digital age. So maybe letting AI help us dismantle the things that we don't like about healthcare, and so that humans can do more of the work that we know our communities need.
Yeah. Thank you, Simi. And I can't wait to meet everybody on LinkedIn and support each other and empower each other and change the world.
Absolutely. This is the Digital Therapeutalks podcast. I'm your host, Simi Byrne. Melanie Doss on LinkedIn, DAS is her last name, and we look forward to hearing from you.